Awesome. So next up, we have the Emergency Response Assistant project. This is in Ghana. And we also have Todd joining us to ask a couple more questions. So let's play the demo.
Emergencies, although can be managed, are inevitable in our everyday activities. The effort of managing them has given birth to a major problem in our communities. The general public is so ignorant about emergency cases and the appropriate first aid procedures. Few emergency cases are reported to the emergency response team. Even if cases are reported to the emergency response team, they find a difficulty in locating the victims. The government and health authority is spending a lot of resources to address this problem. Is there a better solution to this problem? Emergency response assistance is a two-way system approach to solve the critical problems associated with the current emergency response system in Ghana. When there is an emergency in your homes, school, work, or public area, all you have to do is report your case. Health authorities will receive your report with your exact location and respond to you. Location routes are generated for the health authorities if there is a need to get there to the victim in person. With just a click of a button, a life can be saved. The system allows health authorities to publish health tips and first aid procedures.
Hi, it's great to see you. Project
Hello.
Emergency Response
Hi.
calling in from Ghana. Great. How are you all doing?
Yeah,
You're doing
fine.
great.
Good. Great. And we have Todd joining us as well. How's it
I'm
going?
still
Todd?
here. It's going
Good.
great.
Hello, Kyle.
Hi, everybody.
Hi.
So I'm just going to get started with the questions, if that's okay. I wanted to ask the team, because I hear this sort of an interesting story. What inspired you to create this app in the first place?
Okay, Kyle. I'm Yao from Kumerica, Ghana. So the inspiration behind our project is a very personal experience that we went through. One of our mates, who is actually part of this team that developed this particular solution, was bitten by a snake on campus. So we were about 5 with him then, but almost everybody around didn't have any knowledge about snake bite first aid or first aid for snake bites. Right? So we decided to call the emergency response teams for assistance. But what happened was the links and the medium of communication that we were going to use with them were all busy or wasn't going through. So we were like, wow, we had to carry our friend from campus to a nearby institution or a nearby hospital. Right. So after the ordeal, what we decided, it was also a nearly fatal experience, but God being so good, we are here. So after the ordeal, what we decided to do is we decided to come and investigate and see whether we were the only ones who went through that particular problem or that particular experience. But we were shocked to see that almost 90% or almost everybody that we questioned had gone through that particular experience before. So we decided that why don't we build a particular solution or a solution to counter this particular problem? So that's basically our inspiration behind this project. And it was very strong to get us going. Yeah, thank you.
Wow, that is the story. So your teammate who was bitten by a snake, is he okay? Everything's good?
Yeah, he's okay. Yeah. He's actually a prince.
All right. And your leg is good? You're feeling okay now?
Yeah, I'm good. I'm good.
Excellent. So I wanted to ask, like you said that few cases are even reported to like emergency response teams. You mentioned that in your video. So why is that? Is it just because the system gets overwhelmed?
Yeah. So what has actually happened is it mostly when people get in emergency cases and report to the emergency response team or try getting in contact with the emergency response team, and they don't get answers, or the emergency response team fail to locate them based on the location description the victims give. No, it has happened for a long time. So what people do actually now is they don't try to even contact the emergency systems, the emergency response teams anymore. They try to find their own means to solve their emergencies. That is why there have been few cases that has been reported to the emergency systems.
Gotcha. Okay, and that's obviously something you're looking to change with this app. So have you shown a demo of your app to any sort of organizations or emergency services in your area, and what's been their reaction?
Okay, so we were very fortunate to have a clinic in our university. We communicated the basic idea to them, and they were very interested. They really helped us in the development of the system. And when the system was a state that was presentable, we presented it to the Red Cross Society on our campus, and they were also very interested, and they have given us the green light that if we are ready, we can bring the system to them, and they will introduce us to the National Red Cross Society too. And also we contacted 2 hospitals, and they are also ready to receive our proposal for the implementation of this system in our country. And we are very excited about that. And we are also working harder and harder to see this solution implemented. Thank you.
Wow, that's very exciting. I did want to ask one technical question. Since I do have the sweater, can you tell me how Firebase is incorporated into your app? Like what parts did Firebase hopefully make easier, and maybe what parts were challenging still?
Okay, so after the design of the system, we looked at the architecture, and it was like, wow, this is very complex. But it was very fortunate that we have heard about Firebase, so we reached out to actually this is the first. That was the first time I used Firebase, and it was very easy to learn. It wasn't that complicated. You just have to do so many things with just a little code. And it was very interesting. We used the Firebase Firestore for real-time data processing. You see, emergencies have to be processed in real time, and Firebase Firestore was there for us for authentication. Firebase authentication was there, and we needed to send notifications to the health authorities too, and that too. Firebase messaging tool was there. So it was like we didn't have to worry about any backend complexities and other things. All was there for us in Firebase, and we are really, really excited. We really love Firebase, and that has even encouraged us to use Firebase in many projects now. And we are using it. Our institution is using it now for our course registration, and it is going well.
That's great. That's great to hear.
Great. Let's take a question from the live chat. How does the application detect fraud complaints?
Okay. So currently the application is still in kind of a beta mode, right? But we use the Firebase authentication, so it hasn't been actually deployed to the wide public right now. We are testing it with some volunteers that we have in the WhatsApp group and the health officials that we've contacted. So basically what we do now to detect fraud complaint is because we authenticate users using their emails, right? So we actually are hoping that users, because their information in the app is special to them, they wouldn't report fraudulent. They wouldn't send fraudulent complaints to the health authorities, because they know their location and their personal information are also being sent as part of the report. So we are hoping that users will stay put to it, but it is currently in a beta testing environment. So as we go on, we have plans in adding a lot of systems or a lot of other stuff to make fraud detection very simple for us.
Okay.
That sounds great. Do you have time for one more question, or do we have to move on?
We do have to move on, unfortunately. I wanted to hear more, but it was really cool hearing about your project. Thanks for all your great work on that.
Yeah, thanks so much
Thank
for
you.
sharing with us. It was really interesting.
Yes.
And thank you,
Thank you
Todd,
very much,
for being
Carl.
with us for the last couple projects.
Oh, sure. Happy to be here.
Great. Sounds good. And hopefully I'll see you in person with that sweater on around Christmas time. So
That would be fantastic. I'll make a trip.
yeah, sounds good.
All right.
Great. Thank you so much, team. And great to see you all. Thanks for sharing your projects with us.
Yeah, you're welcome. We love you all.
Oh, we love you too.
We love you too. That's so nice.
Bye. Bye.